Hello, my name is Dr. Fred Sylvester from New Hanover Chiropractic, and again, welcome to this episode of Health Talk. Today we're going to talk about elbow pain, and there's a couple different conditions that sit in the elbow. What we're looking for here is we're looking at golfer's elbow and tennis elbow, and really what these things are called tendinitises, and tendinitises is just really a component of where things get inflamed at this point. So what I want to look at here is we want to kind of look at how the elbow is made up of. So when I look at Dr. Karen, we have a humerus sitting here, we have an ulna sitting here, and then we have the radius sitting out through here. These three bones make up the elbow itself. Then you have a swath of muscles that sit on both sides. This group here is called the flexor side. This group here is called the extensor side. Both of these, when they're overworked or even weakened at this point, can then start to result in many different kind of pains that sit on the outside of the elbow or the inside of the elbow. Today we're going to kind of talk more about medial epicondylitis, which is called golfer's elbow. Over the, I'll say the last 20-some years of treatment, this is a very common condition that affects about 4 million people annually in the United States. We know that 60 million people participate in tennis and in golf, so we know that there's a high demand that's being placed upon these tissues here that sometimes what can happen is can create an inflammatory process which then creates an injury. So I always think about this. We always want to kind of step back and think about what inflammation is, okay? And the cardinal signs of inflammation are going to be basically this. You're going to have redness at the site. You're going to have some type of pain sitting at that site. You're going to have heat coming off of that. You're going to have pain, and then you're going to have some type of loss of function and also swelling. When all those things kind of are present at that time, then ultimately what happens is we get an inflammatory response. Our whole object of, I'll say physical medicine, whether it's chiropractic, physical therapy, occupational therapy, is to manage that and to make that system become a little bit more optimal and a little bit more, we'll say, functional in the regards of life. And so where we see most of these people is not just a golfer thing. We see anybody who's kind of doing their hands where they're gripping a lot. Okay, that can be people on computers, that can be weightlifters, that can be carpenters, that can be many different things.
Book readers, phone users.
Yeah, everything that kind of puts you in this position here, that's repetitive. So these particular groups of injuries are basically called overuse injuries or repetitive traumas. So with that being said, as we start to understand what's going on in the inflammatory process and how we can start to mitigate this, we want to show a couple things of what you can do at home to help if you have this inside elbow pain, okay? The first thing I would like to kind of come across with is understanding massage, okay? Massage is a kind of a very old school, technique, but really what it comes down to is when we're looking at this, the muscles, they go from this bone up here the whole ways down into your hand, which make you go ahead and squeeze and open. So when we do any type of self-massage, we want to kind of go up and down this muscle here in a longitudinal fashion, or you can go even side to side. But it's very critical that you kind of get into this and you start to establish where you might feel a little bit of tenderness and tautness through this area here. But most importantly, when you go up towards this area here, where the actual pain is going to be mostly felt, we want to use a specific technique called cross-friction. And so what I'm going to do here is I'm just going to come side to side, and we're going to hold this for anywhere between 30 to 45 seconds, and we're just going to continue to move back and forth. So it's not just where I'm pressing and doing this. I want to see the tissue move back and forth. And that glide is what's going to start to create a healing mechanism that goes with this, okay? So another technique on massage is called ice massage. And what you would do here is you take this Dixie cup, you'd fill it up with water, and you'd freeze it. And then after it has frozen, then what you're going to do is you're going to peel this back piece off, just like so. And you're going to have exposure to the ice, okay? And then so what we're going to do here is that I always say that when you first start using this, the top surface is going to be rough, so you can take your hand and you can rub on top of that, will kind of make the smoothness of that. But then you're going to take this Dixie cup that's going to be filled with water. I'll do it on this side here. And what I'm going to do here is I'm just going to make small little circles, and I'm going to roll the whole ways down to the hand, and then I'm going to come back up here. Now in this area here, what I'm going to do is I'm going to rub, and this is going to be probably anywhere between 3 and 5 minutes. Is what you're going to do is you're going to do long strokes down and then really focused treatment up top here. What you're going to do for here is that this is going to be drippy, right, Karen? So what you're going to do is you're going to put a towel underneath here as this drips all over the place, and what this will start to do is this will start to create a numbing effect. So in that numbing effect, then what's going to end up happening is you go through a concept of called C-band, cooling, burning, aching, and numbness. Each of those take about a minute to a minute and a half to achieve. So once we achieve that, then we can start to move into some of our strength training, okay? So right now what we're going to do is we're going to work with a very low amount of weight. This is going to be something where we're going to work the eccentric motion of this as well. So I'm going to have you take a seat, Karen. What you're going to do is you're going to hold this into your hand and you're going to just let it set out here like this, okay? And what we're going to do is we're going to let that weight kind of come straight down here like this, and then you're going to take that off of your hand with the other hand and take that away, and now you're just going to come straight back up, okay? So it's going to be an eccentric contraction where we lengthen, hold, replace, now come up and squeeze, okay? This is going to be the early phases of how we strengthen this, and this is going to be anywhere from 8 to 10 reps, and in that, what we're going to do is we're going to start to build strength into the actual forearm, and we're going to create the concept of healing by lengthening the muscle as opposed to contracting it. When time goes on and you feel better, now we can go ahead and take that same dumbbell and we can go down nice and slow, and now we can come back up. And if that doesn't elicit any type of discomfort or pain, then this is how you know that you're starting to heal that particular condition as well, okay? So that's one of the biggest things that you can start to look at here. We also can use many other different techniques. You can use hammers, you can use all kinds of different things that help us move in a direction to start to create healing in strength patterns. But then after the fact, then we come into the concept of stretching. So stretching, I call this stretching on the clock, okay? So if we have this condition going on here on the inside, our stretch is going to be more like this, where we're going to start with a bent elbow. We're going to grab onto these fingers, on the tips of these fingers, and the reason we're going to do that is because the muscles that control this are going to be a muscle called the pronator teres, the flexor carpi ulnaris, and the flexor digitorum superficialis. These muscles here have a direct impact into the common flexor tendon, which creates a lot of discomforts and pains. So it's very important where you put your hand in order to get that stretch. So when we come here, we're going to be 90 degrees here, 90 degrees here, and we're going to grab onto the tips of those fingers. And all we're going to do is we're going to pull down to 6 o'clock, just like so. And that's going to give you a strong stretch right through here. Then we're going to start to move into our 7 o'clock position and our 8 o'clock position by coming out through here and pulling through there. And then we're going to move into the 5 and the 4 position, just like that. And then we're going to come up this way and go into our 12 o'clock position, pull back. Then we're going to move into our 1 and 2, and then we're going to move into our 11 and 10. If you find any particular area that's more like the sweet spot of that, you're going to hold that stretch for 30, 45 seconds. Otherwise, each of those movement patterns are going to be nothing more than 5 seconds at this point, okay? This is going to start to create some type of flexibility and some type of range of motion that's going to start to balance the tissue tightness and the tissue strength, is what we're going to look at. Last but not least, okay, we're going to look at this, okay? There's a multitude of different things that we can do with these, and what you're going to look at here is you're going to look at this little brace that helps deload the area. So say, for instance, your job has an area of where you're always kind of doing this, and the work itself that you're doing makes this feel worse. You can take these golfer's elbow braces, or you can take these tennis elbow braces, and what you're going to do is you're going to apply them to the actual elbow themselves. But this does not go directly over your pain pattern. It's going to come down maybe about a thumb's width down from where the actual injury is. So if your pain is here, you're going to place your thumb here, and then you're going to put that on just like this. So I'd come here like that. We always want to put the hand a little bit into extension. Okay, we're going to pull this across, and then we're going to tighten this accordingly. As that tightens, then what this is going to do is that's going to allow us to work the muscle to relax from this point up, and from this point down it's going to be able to work. Rest is a very key component, whether it's on the outside of the elbow or on the inside of the elbow. Also, KT tape can help you as well. KT tape is, again, it's a pain management tool. And there's different ways that you can self-tape that as well that will take pressure off the elbow and allow you to start to move into more of a healing mechanism as well. From elbow pains, you might look tremendously healthy, look like everything's in place and nothing is ever bothering you, but it can be one of those conditions that can be one of the most devastating ones you can look at. I have patients in here when they're going ahead and they're sleeping at night and they go to try to grab the covers to pull it up over them, and they'll be, listed it with this sharp, terrible, terrible pain at this point. So it can be very debilitating even though you might look completely healthy. Good day and good health.